If parenthood came with a GPS, it would most likely just say recalculating. Join Yolandi Becker and her guest experts Wednesdays at 11 a.m. Bump and Beyond, the show about pregnancy and babies, is brought to you with compliments of Dis-Chem Baby City.
Good morning, good morning, good morning. Yes, you are on Bump and Beyond, and I am your host, Yolandi Becker, and as always, we are talking parenting. My favorite subject, I've decided. I really love being a parent, and on that note, I want you to take a moment today in this freezing cold weather that we're experiencing, because it is really not nice. I hate getting up in the morning when it's so dark, but take a moment to just, enjoy the fact that you are a parent. I mean, I'm all for complaining about it. I know I can complain about it nicely, as you all know, but in the same breath, my daughter has started this funny habit in the morning now that I have to sing to her when I wake her up in the morning. So I start my day off by saying morning has broken to go wake her up. But I mean, isn't that so nice? I find it so beautiful. And just think about it, how much joy they bring to our lives. Yes, they can be a pain in the butt. I do know that. And they can be annoying. And they can be also, it can be super hard work. But come on, we will all do and choose this all again if we had the choice. Because it is just, you cannot believe the amount of love you can feel in your heart. It's just so beautiful. So just take a moment and revel in the love and the happiness that is parenthood. Luckily, though, for the annoying parts and for the more difficult parts, we have created this podcast and radio show to help you navigate with expert help through the parenting journey. I want you to please let me know if there is specific topics that you want me to cover in the future. I think we've covered quite a lot. I have learned quite a lot from this show myself, from the experts we had on the show. But again, I want your input. So please do send me a DM on Instagram. It's Yolandi Becker, is Yolandi with a J, not with a Y, Yolandi Becker. Send me a DM, or you can obviously send an email as well to Yolandi, which is Yolandi with a J again, at goodnightbaby.co.za. I would love to hear from you. Even if you send it to the studio, Kathy@chaifm.com. I'm sure she was going to forward me the email. So whatever you decide, you can do. And then we can also have some topics that you specifically want experts advice on. And remember, if you miss the show live, you don't have to worry. It's available on a podcast on our website, chaifm.com, for you to go enjoy not only my show, but all the shows that are on Chaifm. If you don't have the app yet, remember, you need to go download it, because that's how you access all these things. You can Telegram directly from there and be with us all the time. So go do that now. Today's show is it's always a nice show. I always thought it was going to be it's always interesting. I'm not going to talk about nonsense here, even though I've spent about 3 minutes now already rambling on. But today is a topic that I think is very relevant. And sometimes I feel a little bit neglected as parents, that we don't really think about it all the time, but we should. My son now not recently, that we've been on this journey now already for a year. He's actually almost done. That he's had to get his teeth fixed. His teeth is a little skew, and he had quite a bit of an overbite and things like that. And he had to get braces. And fun and expensive activity, a lot less stressful than what I thought. Yes, I didn't say that to my son because I didn't want to freak him out when he got that. But in my head, I thought, oh my word, this is going to be horrible. He's not going to be able to eat. It's going to be a disaster. And actually, it's been really nice. And his teeth, he was handsome before. It's already, even with the braces, you can see the difference already. And again, I just feel this is sometimes something that can be, because he's now 12, by the end of this year, as soon as he goes to teenagedom, he's going to be done with the braces. So without braces. And if you've got these, you can't do it too early, that I also have to say. But it's made such a difference. And I'm excited for him that he's going to have this. And I'm not the expert on these topics, though. So luckily, like I said, as always, we bring in the experts. But specifically today, I don't just want to talk about orthodontal care and braces, because not all children need that. But I want to talk about the most common issues when it comes to dental things, because there is a lot of problems children can have with their teeth, and a lot of it that we probably can avoid. So as always, I have the experts, mom and pediatric dentist. Dr. Valentina Duncan is joining me. Valentina, thank you so much for joining me today.
Hi, Yolandi. Thank you for having me on. Great to be here.
It is fantastic to have you. And I always love talking about, it's funny, about dentistry. Because I think it makes such a huge difference with everyone's confidence if you have a beautiful smile.
Yeah, absolutely. Absolutely. Yeah. And it affects all of us.
Yes. And in the long term, I mean, the other day, for instance, I saw a little boy, he fell down. And I mean, he's 5 and he fell down and he hit out both his front teeth. And obviously these are now milk teeth and the permanent teeth have not come out yet. And I thought by myself, it's like, I mean, he looks cute in some ways with this funny teeth out, but in the other ways, it's like, now you have to wait a little bit for the other teeth to come out.
Yeah.
When do the permanent, I can't even remember, when do the permanent teeth come or start with the front teeth?
So generally, the guidelines would say from 6 years old, they lose the bottom baby teeth, the middle ones. So it's usually about 6, but I've had some patients from 4 years old already losing those teeth.
Yeah. See, and I mean, it's just like the teeth coming out when they're babies. It's different.
I know. Yeah, exactly. Yeah. So around about 6 years old is when you would expect it. But that little boy at 5 years old losing those top teeth, the top teeth come out a little bit later. So he's going to be toothless for a little while, which is cute. Like you say, it's cute, but I'm sure for him it's quite an adjustment.
Yeah, it's not the end of the world. You're also thinking that, but in the same breath, I'm also like, eating must be influenced by that.
Yeah.
But on that note of losing teeth and the tooth fairy coming, I would love to hear from you how much money you give your kids from the tooth fairy. Because there's a very wide array of some people only give 5 rand, some give 10 rand, but I've heard parents who give 100 rand and 200 rand from the tooth fairy for these milk teeth. So as always, I want you to be part of the conversation. So if you want to share how much money you gave for the tooth fairy, also grandparents, share that with us. That would be interesting, because I'm pretty sure I only got 1 rand from the tooth mouse. We didn't have a tooth fairy. So share with us how much money you're giving or got from the tooth fairy. I would love to know. And how much your kids are getting now from the tooth fairy or from the tooth mouse. Share with us this information. Or if you have any questions for Dr. Valentina Duncan, you can, of course, send us a telegram on 061 895 1019, or you can SMS us at 34519. SMSs are charged at R1.50.
This is Bump and Beyond with Yolandi Becker, is brought to you with compliments of Dis-Chem Baby City.
Yes, if you've just joined me, you are on Bump and Beyond with me, Yolandi Becker, and we're talking parenting. Specifically today, we're going to be talking to Dr. Valentina Duncan, a dentist, about the most common dental issues. Again, as always, like I mentioned before the ad break, that I want you to be part of the conversation. So if you have questions for her, or you want to share with me how much money your children are getting from the tooth fairy or the tooth mouse, please do send us a telegram on 061 895 1019, or you can SMS us at 34519. SMSs are charged at R1.50 to let me know these things. So, Valentina, we were talking about these teeth now falling out when you bump them out. I mean, that must have also hurt on that note. But what are some of the most common issues that you see with children with their teeth?
Well, the absolute most common thing that I see is definitely decay, cavities, and varying from young, like under a year old. That's where it can start already when the kids are drinking
Really?
milk.
So
Yeah,
young?
absolutely. Yeah. So I don't think people always know that it can happen from when children are drinking milk, falling asleep with milk in their mouth, not necessarily just the bottle, also from
Yeah.
breastfeeding. So if there's any milk, obviously when they're very small, those teeth have just come out, they're still vulnerable.
Yes.
So often falling asleep with milk in their mouth or feeding often throughout the night, that is where a lot of times cavities can start. So that
Because
is
I wanted
the
to
most
just now
common
say
thing.
to you, I mean, a baby under one, it can't possibly be a whole bunch of sweets that they're
No, no,
eating. Well, I
yeah,
hope not.
no. So that, I mean, obviously they need to have their teeth there. So if they have their teeth and they're drinking milk throughout the night, it's not a guarantee, but it can start very young already.
Yeah.
Yeah.
So, but when do you say so? Tooth decay. Now you're saying, obviously with even with small children, do you see a lot of when do people start giving sweets to their children and then it becomes a problem?
Yeah,
What
usually I'd
happens
say
with the
around.
tooth? Why is milk making such a huge big difference?
It's not just the milk. So let's just get that straight. Obviously, when the kids are having milk and sweeties and juice, and often people will give, or parents will give tea with honey. When you're adding a lot of sugars, milk is not bad. That's not what I'm saying. But basically, it's just the frequency of it. So a cavity will start from plaque, bacteria in our mouth, and that bacteria needs a form of nutrition. And just like sweeties, other food, milk is a form of nutrition for a human being. It's also a form of nutrition for bacteria. Bacteria feed off of that, and their byproduct, their poo basically, is acid, and that acid is what damages the teeth and starts causing
Oh,
cavities.
that
Yeah,
is so interesting because,
yeah,
again, like I said, I mean, you don't even think about that. And
yeah,
I mean, from a sleep perspective, we're also quite keen on not having milk
yeah.
during the night, especially at a certain age. But I mean, this is just an add on to say to parents, listen here. Especially as soon as your children then have teeth,
Mm.
then they need to. When do the milk teeth? It starts also at varying ages. Some
Yeah, it
babies
can
already
start.
have it quite early.
Yeah, usually from 6 months, but very rarely you can get it. Some kids get it from younger ages, but I would say
No.
generally from 6 months, that is when you can start expecting a child to start getting their primary teeth.
Yeah, and
Yeah.
like I said, from a sleep perspective, we're also quite keen on moving that away. So
Yeah.
and you're also saying it's not about taking the milk away. Obviously, milk is good for them and they need to
Mm.
grow with milk, but you can't be giving them milk every 2 hours in the
Yeah.
night. And yeah, how often does the frequency need to be for them to actually start having teeth problems?
Well, I suppose, in general, if that milk is sitting on the teeth for long periods of time and you're not allowing saliva in the mouth to rinse away that milk and it just sits there and accumulates. So it can get quite technical in terms of like the frequency of it. But
Yeah.
yeah, I think if a child is feeding throughout the night while they're sleeping, there's decreased salivary flow. Saliva helps protect our teeth because it rinses away food, bacteria. It protects them basically.
Yeah.
So, the more exposure there is to food, sweets, milk, the saliva is not getting a chance to actually rinse away the milk, rinse away bacteria, and also keep the pH of the mouth at a good level where bacteria can't thrive.
Yeah.
So it's all about that. Yeah. And also, I also think the other thing, I'm sure you would have got into this, but when children are quite young, I get the idea, or what I've seen through experience, is that parents aren't always brushing immediately as the children get their teeth.
And
I
I
don't
just
think
wanted to
people,
ask you that. So when
yeah.
are we supposed to start brushing the teeth?
When the first tooth comes out, That's when
Makes
you
sense.
start.
I
Yeah.
feel like we should know these things.
Yeah. But I suppose, I don't think everybody realizes that because you have a baby, you don't think about brushing a baby's teeth. But a
Yes.
tooth is a tooth and you need to start brushing.
But
So,
because there is special kind of toothpaste and toothbrushes and stuff
yes,
for
yes,
babies.
yes,
Do you still do it like twice a day in the morning and the evening? How
yes.
long should you be brushing? What is this special toothpaste that we should be using? Because fluoride, obviously, toothpaste contains fluoride. Isn't it
Yes.
dangerous?
So fluoride is dangerous only if too much of it is ingested, but fluoride is very beneficial when it's on the surface of the teeth. So it has a very protective function. It also strengthens the enamel of the teeth. It keeps bacteria at bay. It almost neutralizes the bacteria so that they aren't able to cause cavities. So when they're very small, so under 2 years old, they obviously don't know how to spit out the toothpaste very well. So then we would advocate for either no fluoride or very little fluoride, but usually just to be safe because you never know how much they're consuming when they're
No.
brushing. They usually just suck the toothpaste off the toothbrush when they're so little. So then I usually would recommend a fluoride-free toothpaste, something, you get lots of different kinds nowadays. All different brands have them.
I think you
So,
even get like little like wipes that you can use.
yes, you do. And they
Yeah.
contain xylitol. Xylitol also has it's not just a artificial sweetener. It also has a good function of keeping, it basically also neutralizes bacteria that we find in our mouth. So then they can't cause cavities. And then it also keeps them under control. They can't replicate,
Yes.
So yeah. So that is also a good thing. That's why these wipes that you find,
Yes.
teething wipes, have xylitol in them. It's not just
that
to make it
must
taste
be
nice.
easier to
Yeah.
clean your kids' teeth when you can use your finger to kind of just wipe the
Absolutely.
teeth.
Especially if you're this baby who doesn't want to open their mouth and it's
Yeah, I
crying.
mean, I can't even remember. I feel like I don't really want to say it out loud, but I can't remember if I really brushed my kids' teeth when they were babies. I'm not
I
sure.
don't think a lot of people actually do.
I really can't recall that I did.
Yeah.
But I can remember later that I definitely did. But I don't know if it came out if I immediately did it.
Yeah.
That I can't recall. I assumed breast milk was going to be sorting it out. Because breast milk is magic,
Of course it is. Of course it is. And that's what I say. It's not the milk necessarily that's bad, but the fact that milk is a form of nutrition.
Yes.
Bacteria can feed off that, So, it's just about keeping it clean. It doesn't have to be complicated. Brush twice a day. You're not just about keeping the bacteria the milk under control and the accumulation of plaque under control. It's also just about, building good habits. If you start at such an early age with brushing twice a day, if you're going to start it at 2 years old, your toddler's going to be like, what? Why do you want me to brush my teeth twice a day? So, yeah.
I think we're all learning here. And my kids, their teeth is fine. Says the person just said, but I mean, it wasn't because of cavities that my son had to get braces.
Yeah.
But yes, if you've just joined me, you are on Bump and Beyond. This is chaifm.com, 101.9 Chai FM. With me, Yolandi Becker, and we are talking about pediatric or problems with your child's teeth, the most common ones. And it's very interesting because my guest now, Valentina Duncan, was mentioning to us that one of the most common things is actually tooth decay, even for children under 1 year. And it's milk, even breast milk, that can cause it. And she said that as soon as the teeth start coming out, you need to start brushing. If you've missed the show so far, don't despair. Remember, it will be available as a podcast on chaifm.com, so you can go and listen to it afterwards. But now you say that Valentina, that we need to start brushing as soon as the teeth come out. And we've got the nice wipes. There's lots of things that we can use for that. But when do we actually have to start going to the dentist?
So actually, also, especially new parents, if it's your first baby and you're not really sure, like you don't know when to start brushing, what toothpaste to use, what toothbrush to use, all these sorts of things, it's actually very good to actually bring your child when their first tooth comes out, because then it's more an educational appointment for the parents. So of course, you're bringing the child to the dentist, exposing them to the environment. Usually, we just have a quick look. there'll only be a couple of teeth anyway, but it's more about teaching the parents, okay, you should be using this toothbrush, this toothpaste. And often, my child refuses to brush their teeth. That's often what I hear at these appointments. And then, it's also just about educating, that is just something we have to do. We have to brush our teeth. We have to bath. We don't get to not do that. But, things like that. Also, another thing that I find that a lot of parents don't know is that they need to floss a child's teeth. People don't know they need to floss children's teeth. So, you would think it would be common sense, but a lot of people don't know. So this is why I say, just as soon as the first teeth come out, bring your child for the appointment. Like I say, it's more for the parent than the child. And then, as they get older, just have regular checkups so that we can always just keep the teeth healthy, always be checking. If you bring your child regularly, it's very rare that some major problems will start.
No, I know. And I mean, prevention is always better than cure.
Yeah.
But on the note of flossing, Valentina's probably not going to say you have to floss every day. I wouldn't need that. It's probably only dentists that floss once a day.
No, I think you'll be surprised.
And I actually am pretty good at flossing my own teeth and my daughter as well. My son, less so. But a revolutionary thing that I found with the braces now was a water flosser.
Yeah.
I thought, it's like, how did I not know about the existence of a water flosser until this point in my life? I was literally 39 years old when I found out about it. At least before 40.
Yeah.
It has changed my life. But again, the dentist said you still should normal floss.
Yes, for sure. It doesn't replace normal flossing, unfortunately, but it is a cool thing to have.
Especially with braces.
Yeah, 100%.
No, very cool. So now you mentioned the milk obviously can have an impact, but what about things like dummies and bottles and things? Do those have an impact on teeth?
So for sure, dummies and thumb sucking. So those are more habits. Those are not really related to cavities.
Yes.
So when it comes to a habit, like sucking a dummy or sucking a thumb or finger sucking in general, those can affect basically the shape of the jaws and the bite of the child's teeth, right? So often with dummy use, then you'll find the child can have like an overbite, or an open bite is commonly what we see. You almost see like the bite looks like the shape of the dummy. And what that means is when the child bites closed, you still see an opening in front. The teeth don't cover each other. The top teeth don't cover the bottom teeth. So you see that very commonly. I've experienced
with that now. My son had a bit of an overbite.
Is it? Yeah.
And he didn't even have a dummy or a thumb.
So often it can be genetic, but obviously, with long-term dummy sucking or thumb sucking, things like that, then you often find those things. So we try and advise people. Most of the literature would advise for habits like that to stop by 3 years old.
Okay. But how would you say
earlier?
Thumb
sucking. I would have to say it's very hard. I have personal experience. My daughter sucks her thumb. I really thought we were doing well. And the other night I slept in the same room as her. I thought she had stopped. And then all I heard was her sucking her thumb throughout the night. But anyway, it is extremely difficult, especially when they're really young. You can't take the thumb away. There are some children who would have success with, the nail polish painted on the thumb. It's very bitter. You do get some devices that you can buy, not really in South Africa, but overseas, that you almost put like a splint over the thumb. But it's very rare to have success with a young child with thumb sucking. Then you often find when they're a little bit older, then you send them to a specialist, to an orthodontist, and they used appliances then to break the habit. So it's about breaking the habits, and then they're very likely to have orthodontic treatment. It is a very difficult thing to stop, extremely.
Yeah, and I mean, I didn't have thumb suckers, and I just have to say from also from a sleep perspective, because we do, obviously I do encounter thumb sucking. Very seldom though, that I want to, because often babies do thumb suck or hand suck. It's not necessarily always just the thumb that they're sucking, but sometimes they suck their hands.
Yeah.
And it's interesting because it very seldom becomes actually thumb sucking. So I just want to make parents just aware that you don't have to stress that it's going to become necessarily an issue.
Yes.
And also, I don't know how old your daughter is now. Lots of kids, even when they do thumb suck as small children, they grow out of it. That I've also seen. That they, without any intervention, they do sometimes just stop doing it. It's like my son and my daughter, they had these little taglets that they slept in. And they, at one point, I was getting a little bit worried about it because my daughter was already definitely 7 years old. And I was thinking, I don't know if it's appropriate anymore for her to have this, but I was also not overly concerned because in my head, she's always my little girl.
Yeah.
But then I was also thinking about what if your sleep association is thumb sucking or your sleep association is a dummy or something like that. At 7 years, it would be inappropriate.
Yes, I think
those type of things. So, but in the end, then she went for a sleepover at a friend's house, and then just like that, it was done.
Yeah.
Without even a thing.
Of course. So I think maybe I'm seeing extreme cases where parents are so at a loss of how to get their child to stop, and then they eventually come to me. I don't really see children who have stopped by themselves. I don't hear that because the parents are coming to me saying, well, how do I get my child to stop sucking their thumb? And then, we try
how
different
common
methods.
is that then?
I wouldn't say thumb sucking is that common, I must say. So most likely they have outgrown it, but usually around, I'd say about 4 or 5 is when, that's when they come to me and they're desperate. They're like, okay, now what do we do? And then as soon as the permanent molars start coming out around 6 as well, then we can send them to the orthodontist and they have appliances that they can use to help break the habit and stuff. And often that seems to be quite effective.
Very scary when you say appliance.
It does sound scary. Unfortunately, there's no other name, but there's a thing that they will put in to help stop the habit. But so there are ways to do it. And
but do they put something in their mouth then that they can't?
They do. Yeah.
Okay, that makes I'm thinking that they have this giant thing on their thumb.
No, you do get these things that they put on thumbs. I have been researching it. I find when something becomes personal, you're way more invested in finding a solution. But
hence why I have a sleep business.
Yeah, exactly.
Very interesting.
This is Bump and Beyond with Yolandi Becker is brought to you with compliments of Dis-Chem Baby City.
Yes, and just like that, another show is starting to come to its end. It's like really time does fly when you're having fun, and maybe also when you're getting older because an hour becomes a very small part of your life. But if you've just joined me, you are on 101.9 High FM. This is Bump and Beyond with me, your host, Yolandi Becker, and we are talking today about common dental problems in children. And I've been speaking to my expert guest today, pediatric dentist, Dr. Valentina Duncan. And it's been really great. I mean, in all honesty, there's a couple of things that I've realized I did wrong. Luckily, no serious consequences. I've been very vigilant, but maybe it's because of you and other dentists that I've been exposed to, because my kids went to the dentist quite young already. I think both of them started going to the dentist wiggly teeth at 18 months. And it was they've never had a fear of a dentist or anything, just because I think we did it. It's on the contrary, I think they actually enjoy going to the dentist. My daughter actually told me the other day that we need to go for a checkup again. She's very worried now that she also has to get braces soon or whatever. But I said to her, I'm not sure if it's necessary or not. Yeah. And that was also something that I wanted to add, because often the dentists also they'd say, oh, it's genetic, and I've got perfect teeth. Honestly, go look at pictures of me. I've never had braces. I've got really great teeth. And then I always blame my husband, so if the kids something is wrong. But what the dentist then told me in the end, they could get my jaw and his teeth and vice versa. And sometimes the mix just doesn't work out. And then you have to have orthodontic repair or fixing and whatever. But yes, one last thing that I wanted to ask you as well is that we spoke about what if you're losing your teeth, if your kid falls down or something like that. Do you have to worry about that if your kid loses their milk teeth?
So
too early, I would not
say
planned.
If it's the front teeth, there isn't really too much of a concern in terms of spacing. We always say that the baby teeth, the milk teeth, are space maintainers for the permanent teeth. They guide them into place. If they are lost too early, then often the others drift into that space and the permanent tooth kind of is blocked, So, but that is more common with the back teeth. So we always try and save the baby teeth as long as we can. Those back baby molars only usually fall out between the ages of 10 and 12. I don't think people always know that. They see the front teeth falling out at 6. They think the back teeth are going to start falling out, but they don't. They fall out a bit later. So it's important to look after them, not only for spacing, but for the child's well-being, for eating, for speech, just in general, to take care of them.
Valentina, just like that, we are unfortunately out of time. And it was so wonderful to have you. There were so many tips and tricks and everything. Where can people find you, go follow you? Please let me know.
Okay, so I work at Wiggly Teeth. It's a pediatric dentist practice where we specialize in children's dentistry. So you can find us on Instagram at Wiggly Teeth Dentist, our website, wigglyteeth.co.za. And I think we also have a TikTok page. I'm not sure how active we are on there, but we also have that.
Yeah. Great. Thank you so much, Valentina. Have a wonderful day.
Thank you. You too, Yolandi.